Hey guys, it sounds like you're interested in sedation dentistry. So I'm going to talk to you about the different types of drugs that we use in oral conscious sedation and in IV sedation. In oral conscious sedation, most of the time we use two different classes of drugs. Nitrous oxide, also known as laughing gas, has a bit of an anesthetic quality, so it helps reduce your perception of pain, and it's an anxiolytic, which means it reduces your anxiety. The other class of drugs that we use in oral conscious sedation is a benzodiazepines. Those are your Valiums, your Xanaxes, your Halcyons, those types of pills. People often take those when they go on plane flights, and many dentists are qualified to use those as sedation agents. They're amnestic, meaning they typically cause blurry memory and can even lead to total memory loss, which can be great for those of you that don't want to remember anything about your dental visit. Now, what you need to know is that's less predictable than the IV sedation. In IV sedation, we use narcotics. Fentanyl is very effective in helping to increase your tolerance to pain. It doesn't numb you up, but it keeps you way more comfortable during those injections. Okay? It also gives you a sense of euphoria. That's why drug users use fentanyl, because it makes you feel great. Okay? The other class of drugs that we use is a benzodiazepine. We use that for two different reasons. It's an amnestic, so that means it helps to erase your memory, and it makes that blurry memory, and most of the time you don't remember anything when you're doing IV sedation using benzodiazepines. So that's a great quality. The other super good quality to benzodiazepines is the fact that they're known as what's called an anxiolytic. That means it reduces your anxiety. So it makes the apprehension of being in the dentist chair far less. Typically, my patients don't care what I do to them. I could say, hey, I'm going to crank this chainsaw and cut off your head, and you're totally cool with it, with the use of fentanyl and benzodiazepines, narcotics and benzodiazepines. So that's what you need to know about the different classes of drugs involved in oral conscious sedation and IV conscious sedation. Now, there is a third level of sedation that teeters more in the deep sedation as opposed to moderate. So you have light, moderate, and deep. Deep sedation is when you need a nurse anesthetist, a dental anesthesiologist, or an oral surgeon to provide that sedation. And that's using deep sedative agents like propofol. Now, if you want to be knocked clean, smooth out, where your eyes are closed, that's what you're talking about. That's propofol. And to be completely honest with you, that's really not necessary in the majority of cases. Very, very, very long cases, propofol is great. But usually IV, moderate conscious sedation, takes care of all of our patients. Sometimes we go straight to the deep sedation using propofol for patients that are on pain management. So if you're on pain management and you're taking narcotics on a daily basis or a regular basis, then it increases your threshold to narcotics and would make giving you enough fentanyl dangerous. So we would go straight to the propofol. And believe it or not, redheads really are different. So I've found in my sedation practice that folks that have red hair, they really do react differently than the rest of the world. It's not just a myth. Their sedation can be less predictable with IV, moderate conscious sedation. And so with redheads, we typically talk about going straight to the use of propofol because I know that's going to create a predictable and pleasant experience for you. Now, that's what you need to know about sedation dentistry. If you have any other questions, please let us know.